We are going to talk about yawning and its consequence as ear pain. I am Dr. Arun Prabhu Ganeshan from Apollo Specialty Hospital. So what is yawning? Basically, it's the air hunger that is developing in our body. So whenever there is a deficiency of oxygen, your body requires more amount of oxygen to be supplied to it. And that it indirectly sends through certain receptors in your body to your brain to open up your mouth and open up all your jaw muscles to actually get in this air through its air passages. Now what happens is, these all ENT system is all pressure controlled, and your throat and your nose is connected to the ear through a tube which is called as a Eustachian tube, which is a pressure balancing tube. Now the movement of these muscles in your jaw are intricately connected to this Eustachian tube, which is a muscular tube. So whenever there is a change in the pressure because of yawning, these pressure changes are reflected in your eardrum. The eardrum is a nerve supplied unit, and it is extremely sensitive to any pressure changes, because of which it can undergo congestion. So this we commonly feel this whenever we go to high pressure, a low pressure zone, or we travel from a high pressure to a low pressure on an air flight. So whenever there is a descent in the air flight, or whenever we come down from a mountainous region, we see that the changes from low pressure to high pressure causes changes in the oxygen level, and it leads to a lot of yawning, and it can cause a block in the Eustachian tube, which causes congestion and redness in the eardrum and causes immense pain. All right. So how would we avoid and how can we help us in this situation? As I said, the basic problem is congestion. So anything which will decongest the eardrum is going to give rise to the pain loss. So how we can do that? You can use decongestant eardrops through your nose, because the other end of the Eustachian tube opens up in your nose. You can do through deep breathing, or what we call as the Valsalva maneuver, which is basically traps air inside your nose and allows the ear canal to open up. All right. So this is called as the Valsalva maneuver. And you can also use certain painkillers and steroid, which basically helps in reducing the pain and the congestion, and reduces the pressure inside the ear canal lumen. So yawning basically is not something which you need to worry about. There are other metabolic causes of also yawning, that is whenever there are electrolytic changes in your body, like sodium and potassium level changes, or there are changes in water levels in your body, that can also lead to yawning. Other than that, the most common causes of yawning is where your body is depleted and dehydrated, and it is low in oxygen because of tiredness, where it tends to sense and supply the oxygen that is required to the brain to keep the nerves supple. So simple deep breathing exercises and all these small tips that I've given will help you in preventing the ear pain that is associated with yawning. Thank you.